All right, let's get right into it. Today, we're going to unpack a bit of a medical mystery. It's one that starts in a doctor's office, but you'll see it actually ends up somewhere much, much deeper. This is a story about what happens when our emotional pain gets so heavy that our body, well, it just starts screaming for help. So, picture this. You're in a busy clinic. The air conditioning is humming, there's a long line of people, and in walks our main character, Makcik Salmah. And with a sigh that just tells you everything, she looks at the doctor and says, "I have all the sicknesses. My whole body hurts." So this is Makcik Salmah. And I mean, her face kind of says it all, doesn't it? She is in some serious distress. As the source material puts it, she is suffering loudly. And the person who has to figure all this out, a young, probably slightly overwhelmed doctor named Adam. Dr. Adam, he's doing his job. He asks a really simple question. Where does it hurt the most? But this is where things get weird. She points to her head. Sakit, she says. Her back. Sakit. Her stomach. Her legs. Get this, even her tiny little toe. All of it hurts. You can just imagine what's going through Dr. Adam's head at this point. He's totally baffled. I mean, everywhere she points, there's pain. You can almost hear him thinking to himself, wait, does she have some kind of magical pain-inducing finger or something? It's a funny thought, but it really shows you just how confused he was. Okay, so what happens next? Well, this is where Makcik Salmah starts this long, really frustrating journey. She's searching for answers to a medical mystery where, honestly, all the clues just seem to lead absolutely nowhere. She basically gets trapped in what we're going to call the frustration loop. She goes from one doctor to the next to the next. She's running all these new tests, scans, blood work, the whole shebang. But every single time, the results come back normal. And the most important part, the pain is still there. It doesn't go away. And this is so crucial to understand. Just because the tests couldn't pinpoint a physical cause, it doesn't mean her pain wasn't real. Her suffering, her distress, all of it was 100% genuine, something she felt deeply every single day. Now put yourself in her shoes for a second. This is terrifying. She starts to think the absolute worst. Her logic is, okay, if all the tests are normal, but my pain is very real, then it has to be something so serious, so hidden, that you doctors just can't find it. And that, of course, just piles on more fear and more anxiety. And this is the turning point. Dr. Adam remembers something important from his training, and he decides to try a different approach. He asks a different kind of question. He shifts the focus away from her body and towards her life, her heart. And that's when the real story finally starts to come out. So it turns out Makcik Salmah wasn't just in pain. She was what the source calls heart-tired. Just think about that for a second. She was carrying this enormous emotional weight. Her husband had recently passed away. She and her son hadn't spoken in months. A neighbor was causing her a ton of stress. And on top of all that, she wasn't sleeping well and was just constantly worried about what her future would look like. And right here, this is where you can see the two sides of her story so clearly. On the one hand, you've got what the medical tests could see, totally normal results. But on the other hand, you had this massive, invisible burden her heart was carrying. Those clear x-rays, they couldn't see the months of silence from her family. The normal blood tests, they couldn't measure her overwhelming grief. And that's the real disconnect. So with this new understanding, we can finally start to put a name to what Makcik Salmah was going through. It wasn't some mysterious physical disease after all. It was something else entirely. So the first piece of the puzzle is this idea of Semua Sakit Syndrome. Now, this isn't an official medical term you'll find in a textbook, but it perfectly captures what's happening. It's when all that unprocessed emotional stuff, the stress, the grief, the fear, it doesn't just stay in your head. It has to go somewhere, and it starts showing up in your body, disguising itself as physical pain. And that leads us right to the second part, doctor shopping syndrome. This explains the behavior we saw earlier, that cycle of going from one clinic to another. Her body is sending out all these distress signals, basically screaming, check me, but the real healing that's needed isn't for a physical problem. It's for her heart and her mind. So, what's the big takeaway from all of this? I think the most powerful lesson here is that it forces a complete shift in perspective. It's about learning to see our bodies not as the problem, but as the messenger. You see, all this time, Makcik Salmah felt like her own body was failing her, like it was betraying her with all this pain that nobody could explain. But that wasn't the truth, not at all. In reality, her body was doing the exact opposite. It was actually trying to protect her. All that pain, it was an alarm system. It was a desperate signal from an overstressed system trying to get her attention because her heart was just too exhausted to process everything she was going through. You know, if we could translate all that physical pain into words, this is probably what her body was trying to say to her. It was a plea, a message begging for some self-compassion, a request to just slow down, to be gentle, and to finally give her heart the rest it needed to heal. And that really brings us to the final, and maybe the most important question. Makcik Salmah's story is such a powerful reminder of how deeply our minds and bodies are connected. So the next time you feel some ache or pain that just doesn't quite add up, it might be worth it to just pause for a moment and ask yourself this very question. What is my body trying to tell me?